Sickle cell can really do a lot of damage to your organs over the long term.
Do you remember your last crisis and what did that feel like?
That was my first crisis in 10 years. I knew as soon as I felt it. Relentless pain.
Yeah.
That is so severe that you feel like death would be better.
Wow.
Now they think I'm going to die. Or like, it's not taken seriously as a medical emergency because it's an invisible pain. But also a lot of it is just discrimination, systemic racism. Unfortunately, you know, when you're a young black man going into A&E asking for morphine, you're going to be looked at in a certain way. When you're taking those painkillers and they're not strong enough and you're still in severe pain, that's when you would go to hospital. Beetroot, really good for sickle cell. Another big one is yam. Yeah, yam's a bit of a secret weapon when it comes to sickle cell.
Hello, welcome to Eze Speaks, where health finds its voice. Today we have on Dr. Lewis. Hello.
Yeah.
Welcome to the show. So today's guest is Dr. Lewis Thomas, a former NHS GP, accredited life coach and sickle cell warrior who lives with the condition himself, so giving him a rare, deeply authentic perspective. Through his platform, the Sickleverse, he's built a thriving global online community with education, WhatsApp groups for peer support, empowering sickle cell patients, carers and advocates to navigate crisis, burnout and healthcare mistrust with confidence. He's found on TikTok and Instagram as Sickle Cell Coach. Welcome to the show, Dr. Lewis.
Thank you for having me.
Thank you so
Great
much.
to be here.
Yeah, I think this conversation is well overdue, so we need someone like you on the show. So thank you so much. So tell us a bit about yourself. Who is Dr. Lewis?
I've been a doctor for about 12 years now. You know, I have sickle cell, like you mentioned, hemoglobin SC. And it's a big part of why I got into medicine, because I wanted to be able to kind of like have the knowledge to be able to manage my own condition. And it's something that I think is poorly managed in general by the medical profession because of the lack of knowledge. So my sort of mission now is to share the knowledge that I have, you know, from my experience living with sickle cell and from my experience of working clinically as a doctor.
That's amazing. That's really, really good. And like, how has kind of sickle cell affected your job as a doctor, would you say? Has it really impacted that?
It's not impacted it too much. Like, it's not in an obvious way.
Yeah.
I think it's more been difficult sort of outside of my job. So as a doctor, I've always been able to sort of like work you know, do the best and give my patients the best care that I can. It's sort of outside of work that you then crash and have no energy left, and that was where it was really impacting me. So I, you know, get through the nights and the on-calls, but then when everyone else is going out to socialize as normal, I would just be like absolutely wiped out.
Oh, you're too tired.
Yeah. So that it kind of impacted on my, I guess, well-being a little bit outside of it, and yeah, it's something that I think did start to trigger more pain crisis for me because of the stress.
The stress levels.
Yeah.
So that is a common trigger for like sickle cell patients.
Definitely. Yeah.
Right. Okay. And you know, you do have the Sickleverse, which is a great platform. How can the Sickleverse help, you know, sickle cell patients, would you say? So
the Sickleverse I've kind of set up to help people to just have a reliable, trustworthy source of knowledge. So it all kind of came from me sharing the knowledge that I had on social media and seeing that there's this massive demand for, you know, people wanting to see someone that looks like them living with sickle cell and they can trust, because there's so much mistrust in the community.
Definitely.
And I think it's also like about providing education in a way that people can easily digest. So the Sickleverse, you know, is linked to all my socials with the short bite-sized educational content. We have masterclasses where I'll present a topic and people can ask questions. And then I think the most important aspect of it is the community. So there's people living all over the world, you know, with sickle cell, feeling like they're the only person in the world with sickle cell. And I think the beautiful thing about social media is that you can connect with people.
Definitely.
And the Sickleverse is just doing that. It's connecting that community and letting people know that they're not alone.
And it's like all across the world, you're getting lots of different types of people. So that's really good, definitely. Thank you for what you're doing. Can you explain what sickle cell actually is in just basic English?
Basic.
Very easy. How would you explain that?
So sickle cell is a genetic blood condition that affects the shape of the red blood cells. The red blood cells are responsible for carrying oxygen in the blood to where it's needed. But when someone's affected by sickle cell, the shape of the red blood cell goes from being a circle, smooth shape that can pass through blood vessels easily to a sort of banana sickle shape, or crescent moon. And that means it just can't flow as easily. It gets stuck in the smaller blood vessels. And this is what causes all of the complications of sickle cell. Because areas of the body are deprived of oxygen and nutrients because there's this traffic jam in the blood vessels.
So it's basically the red blood cells that are like circular shape pass through easier through the blood vessels than the ones that are crescent moon shaped. Right. Okay, that makes sense. And so you've mentioned that your genotype is SC. What is the difference between someone who's SC, SS, and AS? Because I get a bit confused, and I know a lot of some people in my family are AS. What's the difference?
Sure. So the genotype, the letters A, S, C, those refer to the hemoglobin type that's found inside the red blood cells. So there's different types of hemoglobin. There's normal hemoglobin, which is hemoglobin A, and then we have the sickle hemoglobin, which is hemoglobin S. And then there's also a variant of that called hemoglobin C. So what determines your genotype is basically the genes you inherit from your parents. So you inherit one from your mom and one from your dad. So if you, in order to have sickle cell, you have to have two hemoglobin S genes. So you can be SS or you can be SC. People who only inherit one, so they'll have a normal hemoglobin A and then hemoglobin S. They're what we call carriers. So that's where the AS comes from.
Okay, yeah. So can someone with AS who's got the trait still have crisis? Is that possible?
So it's not impossible.
Okay.
Yeah, but it's not very common. So most of the sort of education and training on sickle cell will say that people with AS and carriers of the trait shouldn't suffer any symptoms or have crises because basically the presence of the hemoglobin A, the normal hemoglobin, counteracts the hemoglobin S. But because this is an area where there's still, a lot of research needing to be done, there may be other factors that some people who carry their hemoglobin S gene have that mean they're more likely to experience symptoms, or the hemoglobin S is more able to act and change the shape of the cell.
Oh, I see. Okay, that makes more sense to me now a little bit.
The other thing which I think is important for people to know is that with being a carrier, you can get pain and crisis in extreme external environmental conditions. So if you're in sort of extreme exercise, exertion, and dehydration, people with trait can experience pain, and it can lead to complications like rhabdomyolysis and kidney problems. This is one of the examples is army soldiers, military training. So there are a few cases of people with sickle cell trait actually getting very unwell and sometimes fatal outcomes from the severe training because of the presence of the trait there.
Yeah, the stress it's causing. And did they know that it was sickle cell causing that pain at all those cases?
Not at the time. Yeah, there's in different sort of areas, there's now sort of measures put in place to protect recruits that have sickle cell trait.
Oh, that's interesting to know actually as well. I always like to ask why things happen, and I read that we have sickle cell as like a genetic mutation that's helped us over the years to, counteract the effects of malaria and stop, severe malaria happening. So our cells have almost changed shape to reduce malaria, happening or making us ill. Could you explain how that works?
Yeah, I mean, the way it works is like going back thousands of years, basically, to times where people were just absolutely getting wiped out by malaria, and the mutation of the hemoglobin came about because when you have the sickle hemoglobin as a carrier, it's slightly protective against malaria. When I say it's protective against malaria, it just means you're less likely to die from malaria. You can still get malaria and like have bad infection, but the advantage was that you're more likely to survive to a reproductive age. And that is how the sickle cell trait started to spread. But then when two trait carriers came together and have a baby, the presence of the SS causes sickle cell. And that is not advantageous at all. So,
but originally it was made to have an advantage to stop us dying from malaria, but it just happened that we then married someone else with a trait without knowing.
Yeah.
Right, okay. So in a crisis, for example, when someone has a crisis, what's actually happening in their blood vessels? Like, what does their blood vessels look like at the time?
When I was talking about how the blood vessels get blocked because of the awkward shape of these sickle cells, that means oxygen is not getting to areas of the body like the bones and the muscles and the joints. And that causes extreme pain called ischemia. And that's probably like the most well-known symptom of sickle cell is just pain. So if you're looking inside the blood vessels, you will just see like clumps of sickled red blood cells stuck together. They're very sticky as well. They're stiff and they can't sort of
just don't move.
Yeah. So that's what's happening, and it means that the areas of the body that need oxygen are just getting starved and causing lots of pain. And what you will find is that it happens in the bones because they have lots of tiny, small blood vessels. So that's why that's what it causes, the classic pain.
Right. And do you remember your last crisis, and what did that feel like?
So my last crisis was just over a year ago. So it was like March last year.
Okay.
That was my first crisis in 10 years.
What caused that? That's my first. I need to know how did you get away with 10 years of no crisis? You just had one in March.
So 10 years ago, 11 years or something now, I started on hydroxyurea, which is a medication used to treat sickle cell, which I won't go into now. But essentially, I decided that I wanted to see what I would be like off hydroxyurea, because I felt that I'd been on it for a long time, and I felt I just wanted to know whether I needed to stay on it long term. So I stopped it, and 3 months later, I sort of like got back into exercise and like was really pushing myself in the gym and really sort of getting a lot fitter. And the crisis was triggered by exercise when I was just out on a run.
Oh gosh.
And I think it was like, when you remember the sensation of that pain, it's very difficult to like not immediately recognize it.
Right.
So even before it got like to the point where I needed to go to hospital, I knew as soon as I felt it. And if I had to describe, what it's like, it's basically like, I guess there's so many different ways of explaining it, like you could say like it's been like being hit with a metal baseball bat in your bones.
Oh my gosh,
like someone's planted like dynamite inside your bones and just like exploding it over and over again. Electricity. But yeah, I think I wrote about my first ever crisis, and I think if someone wanted to know sort of how it felt like to have a sickle cell crisis, I would say you don't really understand. It's like nothing that's compatible with being alive.
Right.
It's relentless pain.
Yeah.
That is so severe that you feel like death would be better. That's the first experience. You're just like, why am I alive? This is so bad. Like, what am I meant to do with this? So yeah, and that was when I was 12, when I had first experienced that type of pain. Since then, you kind of got used to it. It's really bad and really severe. But I think if you're completely naive to sickle cell, it's worse than anything you can ever imagine.
Yeah, that's crazy. I think there's some type of pain where it's like you just can't explain, like you can't even fathom how to even tell someone how much pain you're in. Do you ever feel like any pain you have in your body, you're just scared that that's just a crisis? Like, or do you know when that pain's a crisis?
Yeah, there are certain times when I do get a little bit scared by sensations that I'm not sure.
Yeah.
So there's like different sensations, and sometimes it's quite obvious that it's not a crisis pain, you know, and it depends what you've done. You've injured yourself somehow.
Yeah.
Like, you know, that's the cause.
That's the cause, yeah.
But sometimes, you know, like everyone just gets random pains sometimes, and that can be it's just an extra thing to think about.
Like, it's in the back of your mind that this could be a crisis. Yeah. Because I think, like, I'm not trying to compare the pain of sickle cell and asthma, but I had an asthma attack when I was 20. That was the first time I ever had an asthma or anything. I didn't even have asthma before that. So I couldn't breathe for like 3 days straight. So now I'm on regular inhalers, but anytime I can't breathe, I always think, oh, am I gonna have an attack? Like, it's just in the back of my mind that I'm like, oh, like it could be a really severe, you know, asthma attack. So sometimes it's a bit scary, but you can't really do anything really at that time. You just gotta do what you need to do at the time, isn't it? In terms of like sickle cell treatments and stuff, during a crisis, when would you know like when to go to the hospital? Do you go to the hospital after every crisis, or is there like a telltale sign?
So when you're having a crisis, you're going to try and manage it at home, and it's just about pain medication, really.
Okay.
So not every crisis is like super severe. Some crises you can manage with painkillers like codeine, tramadol, basically weak opioids, or oral opioid painkillers. So most hematologists will prescribe those for people with sickle cell, so that if they have a crisis, they've got something to take at home.
Fine.
At the point that you're taking when you're taking those painkillers and they're not strong enough and you're still in severe pain, that's when you would go to hospital. There are complications of sickle cell outside of pain that you need to be aware of as well. So when it affects the chest, if there's chest pain or difficulty breathing or any signs of infection, then those are indicators to go to hospital, because infections and chest problems can escalate quickly and need treatment in hospital.
When someone has a chest problem, is that saying that there might be ischemia in like the heart, or is it?
So it's not related, it's more related to the lungs.
The lung. Oh, okay, fine.
So the problem that is driving it is related to the blood vessels in the lungs getting blocked.
Oh, okay.
And then it just reducing the amount of oxygen that can get into the blood, which is then something that can trigger more sickle cells to sickle and
elsewhere as well.
So it's like a vicious circle, and during that sort of whole process, infection is more likely as well. So that's something called acute chest syndrome, which is a really severe complication of sickle cell.
A lot of nowadays they're pushing for us to go do, give blood. They're saying there's a need for Black blood donors as well. So can you explain how blood donation actually helps someone who's living with sickle cell?
So the issue is that a lot of people living with severe sickle cell, they need regular blood transfusions in order to, provide them with normal red blood cells, which can carry oxygen and reduce their chances of sickling. So having transfusions that regularly requires a lot of blood. There's obviously the blood transfusion program in the NHS in England, which is great. We have this blood bank, but the issue is that there are certain antigens which are like ID tags on the blood, like your blood type. There are certain more sort of complicated blood types that people having regular blood transfusions can be exposed to. And this leads them to create antibodies, which then means they can't have that blood type again.
Oh, I see.
So what happens is we have lots of blood from mainly white European people in the blood bank. And because sickle cell, it mainly affects people of African ethnicity, we need blood from more Black people so that we don't have as many, we lower the risk of getting antibodies.
Oh, against the blood. Right.
Yeah.
Because you don't want the immune system to reject the blood that you're actually getting from the donors. Oh, okay, that makes sense. Is it everyone with sickle cell that needs regular blood transfusions? Like, do you have regular blood transfusions?
No, so I've never had a blood transfusion.
Okay,
so
fine.
Sickle cell is something that varies like enormously,
yeah.
like it's a spectrum. Not everyone is the same. So some people have very severe illness, some people are less severe. It can vary over time as well. Some people are quite well when they're young, and as they get older, they get more symptoms. Some people are, really unwell when they're young and, really unwell when they're young, and as they get older, they're better.
Oh, I see. So again, it's very different for everyone.
Yeah, it just varies.
Are you back on the hydroxyurea? You said that you had stopped it. Fine. So how does that help someone with sickle cell? Does that prevent you having crisis, or?
So the way hydroxyurea works is it basically it protects your blood cells from sickling.
Okay.
It's a very sort of complicated mechanism, but basically it increases the level of something called hemoglobin F, which is fetal hemoglobin.
Right, okay.
So this is the hemoglobin that everyone is born with as a baby. So newborn babies have this hemoglobin in the womb, and then it lasts in their blood up until around 6 months of age.
Oh, okay.
And then it just stops being produced, and the normal adult hemoglobin gets
formed
produced
from it. Oh.
Yeah, not from that, but just it's controlled by genes that are switched on and off.
That is so complicated.
Yeah, but basically, what hydroxyurea does is cause the level of fetal hemoglobin to rise again, and because this fetal hemoglobin is basically healthy, normal hemoglobin that's good at carrying oxygen, it doesn't sickle. It can help people living with sickle cell to not have as many crises because it's protective against sickling.
Oh, I see. So that makes sense. And again, the same question, are all patients on hydroxyurea? Would you advise all patients to be on hydroxyurea?
So I'd advise all patients to try hydroxyurea.
Okay.
Because it has proven benefits in terms of reducing the frequency of pain crises and the severity of crises and complications like acute chest syndrome and stroke. However, like we said, sickle cell is different for everyone, and it also means that everyone has different reactions to hydroxyurea. So some people will be more sensitive to it, and they might not be able to tolerate some of the side effects of hydroxyurea. And for those people, they don't need to take it. They can try something else.
Yeah.
But for the majority of people, it works very well and they don't have any issues.
Fine, okay.
However, now we're getting onto the other subject, which is, I think within the community, a lot of the people who've had bad experience with it share their experience as if it relates to everyone. And because there's so much mistrust in the community about medications and side effects and experiments, there's a lot of people that worry about taking medications like hydroxyurea. So yeah, part of what I've been trying to do is spread the message that just try it. Sickle cell can really do a lot of damage to your organs over the long term, and hydroxyurea is something that can prevent that. So yeah, I don't like the thought of people suffering because they're just not aware.
Or they don't trust that the information that hydroxyureas could be beneficial for them.
Exactly. Yeah.
Fine. What do you think is like the greatest misconception that people have about sickle cell that you just want to like end? Would you say?
The greatest.
Yeah.
There's so many. I think we kind of like mentioned it already, but just people assuming that everyone is the same. That everyone is on blood transfusions and in hospital constantly, and I think all of the kind of presumed limitations that people associate with everyone that has sickle cell. There's also the life expectancy. Excuse me. So one of the most annoying things about living with sickle cell is that you will meet new people and eventually, you're in a situation where you tell them you have sickle cell.
Yeah.
And they may have heard of it through someone, and unfortunately they've had someone close to them, or someone they know, die from sickle cell.
Yeah.
And it's like, that's the first thing that they say when you tell them you've got sickle cell, and it kind of like, it's just not nice to hear that.
Yeah.
And that's why I was kind of saying, it kind of makes you feel like, oh, okay, now they think I'm going to die, or like, now I'm thinking about death, and that can, that sort of perception that you're, on death's door, and it's.
Yeah, I can understand why that would be annoying. So it's just having like a positive outlook towards even anyone you're speaking to who's living with any condition as well, just being careful how you speak to them.
Just being like sensitive. I think about, someone living with a chronic condition that has all of these different complications, and they're trying to like be positive and move on with their life, and then you're just sort of going, oh, hey, I knew someone with sickle cell and they died. And then like I've had that, and I think a lot of people have experienced that at school with kids especially.
Yeah.
And it's just not nice to be sort of put in that spotlight.
Yeah. I think just don't tell me that information. Like, and I think it's hard as well, because if you've had someone pass away from a condition, you're more sensitive, or you maybe have a different approach to it. You might be angry, but again, it's just about being sensitive of who you're talking to as well. But I understand that would be frustrating. But let's talk about the positive sides of sickle cell. What would you say is one thing you've achieved, living with sickle cell, that you wouldn't have if you didn't have it?
I mean, I guess being a doctor, I wouldn't have gone into medicine, I don't think, if I didn't have sickle cell. So that is one thing. But also, there's a lot of resilience and hard work that goes behind living with a condition that makes everything much harder than it does for normal people. And, I think when you're constantly having to overcome challenges, it sort of, it grows you develop as a person, and everyone has their own challenges in life. But sickle cell is like my main one that sort of made me develop in a way that I might not have if I didn't have sickle cell.
So it's made you more resilient.
Exactly.
Yeah, that's really good. So if someone was having a crisis right in front of me, what should I do? What would be the first thing you would advise me to do? Or anyone watching someone going through that?
Yeah. So the first thing is to listen to them, because they're probably going to be able to tell you what they need. If you are not able to do something immediately to like relieve the pain, you want to sort of get them water. You want to make sure they're warm. You want to sort of ask them if they need what they need from you. Because people don't just spontaneously go into like the severe 10 out of 10 crisis in front of you. They sense it coming on, and they've probably been sort of ruminating about what to do in their head for a while before they sort of present in a way that you could see that they're in pain. So yeah, I think let them sort of ask you, like just be like, what do you need? Don't ask them a load of questions.
Yeah, that's annoying.
It's irritating. Don't ask them any questions about how the crisis happened.
It's not going to help.
The crisis is here now. The pain is here. Like, this is the main focus is on the pain. So if you put yourself in that situation, just think about what they might need to feel comfortable. In a crisis, the primary sort of factors that need addressing are pain. So you do that with pain medications, do that with making them comfortable, making them warm. And then the other factor is hydration. So people need to be drinking lots of water because the hydration will help to recover the crisis. So yeah, just make sure they have a supply of water.
Fine. Water, warm. ask them what they need, but no more questions after that.
No more questions. If they're talking to you,
let them.
They can talk.
Fine.
You can converse. If they're just in the zone, in their own sort of mental battle, just leave them to it. Don't. I've had sometimes people think you're being rude. You're being antisocial. They're trying to laugh and joke, and you just sense the room.
Sense the room, yeah. But then, if someone's having a crisis, how do I know that this one is more serious? Like, when should I have my alarm bells and go, right, like I need to get help, or what would you say?
So, I mean, it depends on the person and like how well you know them.
Okay.
If it's someone you know well, it's likely that you'll be able to tell that it's serious. If it's someone that you don't know well, then it's just picking up on body language signs that someone's uncomfortable and someone's struggling and in pain. So if someone's in a crisis, they're going to take their painkillers, and if they've taken them and then they're just kind of quiet and look comfortable and they're not restless and moving all around, then they're probably okay, especially if they're telling you that they're okay.
Yeah.
If they are squirming around, crying, very uncomfortable, fidgety, then you should check if they're needing to go to hospital. They need something stronger.
I see.
Because what we have to understand as well is that hospitals are not somewhere that people with sickle cell want to be. Unfortunately, it's not managed very well in hospital. You have to go through a lot in A&E. You have to face judgment of needing severe pain, but looking like you don't have. And it's something that people just don't want to deal with, especially when you're already in pain. So they are going to delay that for as long as possible to see if they can get to a point where the pain is sort of manageable and they don't need to go. But sometimes you have to, like there's been times if I think back to my last crisis, I basically spent the whole night in pain. I didn't sleep.
Oh God.
And my plan was, I'll just wake up tomorrow morning and it'll be fine. But it wasn't. And as soon as my wife woke up, she was like, "You need to go to hospital." And I was like, "Yes." And we just went. And it was just that sort of prompt
from someone else.
Yeah.
But why did you take so long to go? Is it that you're scared that you're going to be treated badly in A&E? You're scared they're not going to listen to you? Why would you wait?
Yeah, it is the fear of it's the fear of being in an environment where you're not in control. So if I'm at home, even if my painkillers aren't working, at least I'm in my own environment. I can drink water. I have some sense of control. It's worse to be in an environment when the stronger pain medication is available, but someone is just
not giving it to you.
It's not that they're not giving it to you. It's that you're having to go through hoops, or you're having to sort of wait, and people are saying, "Oh yeah, we're just going to get it," or the doctor needs to come, and be like 5 minutes, and then an hour passes and another hour passes.
You see, this makes me angry. As you're saying, it really frustrates me. Why do you think that in A&E they're taking so long to listen to someone in a crisis, to say that they are in pain? Like, why do you think there's a delay?
I think it's not taken seriously as a medical emergency because it's an invisible pain illness. I don't think it's given the same sense of urgency and emergency as, say, like a heart attack or a stroke or something like that. And I think it's just because people aren't really educated and experienced in sickle cell. But also a lot of it is just discrimination. There's a lot of systemic racism, and unfortunately, when you're a young Black man going into A&E asking for morphine, you're going to be looked at in a certain way.
Do you think a sickle cell crisis should be a medical emergency now?
Yeah, it is a medical emergency, like technically. It's just
not taken.
It's just not acted on. So everyone who goes into A&E should receive morphine or a strong opioid within 30 minutes. Those are the guidelines from like all of the major sort of hematology bodies in the world. But
that doesn't happen.
You know, it's a guideline that people choose to follow, or yeah.
I've seen it happen before as well. And I see a lot of people on TikTok who complain that they're in A&E for hours and their pain is not taken seriously. And there's this thing of like people thinking Black people can handle pain more than white people. I don't know where that came from. I don't know where that came from, but it's quite frustrating to see. And in like a crisis as well, how long should it last? Like, is there like a time frame for a crisis? Like, how long are we waiting for this crisis to end?
So most crises typically resolve within 2 weeks.
2 weeks?
Yeah, resolve within 2 weeks.
So I thought we're talking like in minutes to hours.
No.
Oh.
So the pain severity level can reduce after a couple of days.
Yeah.
But a crisis in itself, in terms of the pain, it can last, weeks or even months sometimes.
Wow. And can you like in terms of the blood vessels, what does that look like? Because is it that the clump is still there, or the blockage is still there? It's just taking time to open up the blood vessels. Like how does it last so long?
I mean, I'm not 100% sure on sort of what exactly it looks like, but there's a period where there's the blockage, and the body has to clear that, and there's other factors involved like inflammation, and other blood cells like platelets can get like stuck together. So it's just a variable how long that takes to clear, and it usually does clear like a little bit at a time. So if the blood sort of like was completely locked off and nothing was getting through, then there'd be like more severe outcome. But usually there's a little bit that's able to get through, and having blood transfusions or like having fluids helps that gradually sort of clear,
to push the blockage. That makes sense.
But the whole time that there isn't enough oxygen getting to the cells in like the joints and the bones, there's going to be pain. And even when that oxygen does come back, the pain is still going to be present because of inflammation.
Yeah, okay. That makes sense.
And damage that has been caused by the cells not getting enough oxygen.
Wow. Thank you for explaining that. I'm quite surprised to hear 2 weeks, even months. I thought hours. So that's quite naive of me, but thank you for explaining that.
Yeah, I like for me, I'll just say, like, for me personally, it's usually a couple of really bad days, and then it gets better, and it starts to get better for me. Sort of within a week, I'm back to normal. But yeah, people have different severity levels.
I don't understand how someone can go their whole life without having a crisis and have one major crisis. Is there like a science to that? Like how does that work? Because I always thought that someone with sickle cell would have not regular crisis, but quite often, or they have a history of a crisis. So they almost expect it, or they're alert. But sometimes I've seen cases where it hasn't been that.
Yeah, it's interesting because there are other factors involved that determine the severity level and how it changes with time. So one of the common things is that some people naturally have a higher level of fetal hemoglobin than others.
Okay.
So when they're born as babies, they sort of have a persistently high level. So they have sickle cell, but they still have a lot of fetal hemoglobin that's essentially protecting them from experiencing pain crises and other symptoms. But as they grow, the fetal hemoglobin level does eventually fall. So that could explain why someone who's, really well as a child or doesn't really have many crises as a child then hits a point at which their fetal hemoglobin levels drop and they start experiencing pain crises and symptoms.
Okay, that makes a bit more sense as well. I asked you what we should do when there's a crisis, but I didn't ask you what's the worst thing that someone can do during a crisis. So what's one thing that you don't want, for example, your wife to do when you're having a crisis?
Stress me out.
Yeah.
I think no one wants to be stressed when they're in a crisis. So whatever you do, just try to make sure you're not adding more stress to the person who's trying to, trying with every being of their fiber to just hold it together.
Calm down,
because the pain is, going on 10 and they don't need any extra stress.
Fine. Don't stress someone out who's having a crisis. I've noted that. Fine. And also on your page, you talk a lot about strokes as well, and how people with sickle cell have a bit of an increased risk of stroke. How do they have a risk of stroke?
So this is involving the blood vessels in the brain getting blocked by sickle cells.
Okay.
Yeah. Right. So a stroke is caused when there's a disruption to blood flow to areas of the brain. And the brain is then starved of oxygen and nutrients and causes neurological symptoms depending on the area of the brain. So in sickle cell, in people that have a lot of sickle hemoglobin, especially young children between the ages of 2 and 5, they are at risk of strokes where the blood vessels in the brain are getting blocked and causing neurological symptoms.
Is there signs that they could be having a stroke at that time? How would they know?
So, yeah, I mean, the general way of spotting anyone having a stroke is the acronym FAST.
Okay.
So it causes you would look for facial weakness, so drooping of one side of the face, the mouth, the eye. So you might want to see if they're able to smile, ask them to smile.
Okay.
And then if their half of the face doesn't move. And then A is arms. So you ask them to raise both of their arms. If they are unable to raise one arm, then there's a sign of weakness on that side. Weakness in the arms and legs is another symptom of stroke. Okay. And then speech is their speech normal? Is it understandable? Are they able to understand you? The speech is something that can be disrupted by areas of the brain being affected by stroke. So if you see any of that, those are the main things which cover most of the symptoms of someone having a stroke. Any of that, it needs to be acted on immediately. So it's like 999, 911, get straight to hospital so they can have treatment.
Thank you. I feel like I'm prepared now. I feel like I'm prepared for the signs and also what to do if someone's having, a crisis in front of me or signs of a stroke. So thank you. On your page as well, you talk a lot about foods and, fruits or vegetables that can be beneficial for patients living with sickle cell. What's your go-to food choice for someone with sickle cell?
So I wouldn't say it's my go-to food choice because I don't actually like the taste, but I talk about beetroot so much.
Okay.
So beetroot is really good for sickle cell because it's high in something called nitrates.
Oh, wow.
And they essentially help blood vessels to relax and open. So it can reduce the chances of sickle cells getting blocked in the small blood vessels.
Oh, okay.
So yeah, I recommend eating beetroot regularly in smoothies or soup or however you want to have it.
They're not that nice.
the taste isn't great, but a lot of people are giving me a lot of advice about mixing it with things like ginger and apple and all sorts of other
sweet things.
Yeah. I'm not really much of a cook myself, so I just down it.
Yeah. Do you have it every day? Beetroot?
It depends what kind of phase I'm in. If I'm on a fitness and health nutrition phase, then yeah. But I do eat healthy, fruit and vegetables. You really want to be making sure you're eating those regularly.
Yeah.
Antioxidants are really helpful to protect the red blood cells, and those are found in things like berries and
blueberries.
Vitamin C is helpful. What else? Another big one is yam.
Yam.
Yeah.
Oh, I love yam.
So
Fine.
Yam is yam is a bit of a secret weapon when it comes to sickle cell.
Oh.
So it has anti-sickling properties.
Okay.
There's basically a study done, I'm not sure how long ago, maybe in the 90s, by a naturopathic doctor in Nigeria who basically saw that sickle cell patients in Nigeria weren't having as many, I don't know if it was Nigeria actually, it might have somewhere else in Africa, generally, weren't having as many crises and complications as people in America, African Americans. And they found that it was just because of the difference in diet, because yam is such a big part of the African diet.
Yeah.
They looked into that and found that there were anti-sickling properties that yam had.
Oh, wow. Eat your yam, guys. Yeah. We have it in like yam porridge. You have your yam with like plantain. So this is a very common thing that we eat in Nigeria. I think in other African countries as well. Oh, that's a good study. Do you eat yam?
I have it every now and again.
Yeah. Fine.
I have like my parents used to make it often. You know, it's a big staple in the Caribbean as well.
Yeah.
So it's just more difficult to get hold of than I'd like it to be. So yeah, I have yam, have beetroot, eat healthy, and yeah,
whenever you can, isn't it? So with the yam in like the Caribbean community, what do you guys eat your yam with?
I tend to have it with soup. I think this is just coming out of the winter. We have like Caribbean sort of pumpkin soup.
Oh, okay.
So we'll have like yam, plantain, like green banana, chocho, pumpkin, chicken.
Oh, that sounds good.
It's just in like a big pot.
Yeah. Oh, nice. Okay. And because we're on the health and diet, things. Would you still advise someone with sickle cell to be physically active? Because I think there's obviously a fear of stressing your body too much to lead to a crisis.
Yeah, I would. But when I say physical activity, I think people imagine running and lifting weights in the gym and everything, but it's just a case of walking. Just walk every day. Just move, and that is going to be enough. So recently, the only exercise I've been doing is walking every day. Just walk around the park. It helps clear my hair, so it's good for your mental health as well.
Yeah.
And it's very easy to sort of adjust it depending on how you're feeling, and increase the sort of length that you're walking. So if you're someone who is really struggling to do any exercise at all, you can just start with walking and aim to keep it consistent and just gradually build
it up.
Yeah.
Do you do like other exercises like lifting weights and stuff?
I don't really at the moment. I have in the past. What I do is just calisthenics basically. So I do push-ups every day, and that's about it. Walking and push-up is what I'm doing right now.
Yeah.
And I am being very careful to kind of not trigger a crisis.
Yeah.
One of the things that tends to happen, what's happened for me, is as soon as I start to get fit, when you start a new exercise program, it's been like a couple of months you've been training, and then you notice improvements. And for me, I always then think, okay, I'm fit now, I can do anything. And it's at that point that I have a crisis because I've pushed myself too hard. But the actual underlying factor in this is that once you start getting fitter, you're increasing your hemoglobin level because your body is adapting to the exercise, and you're increasing the number of red blood cells that are present in your circulation.
Yeah.
So what that does is slows down how quickly the blood can flow through small blood vessels. So the exercise is great because you're increasing your cardiovascular capacity.
Yeah.
But you're also increasing the sort of crowdedness of the blood vessels moving through small blood vessels.
Yeah.
And when they are not moving through very quickly, they're at more risk of getting sickled and getting stuck.
Okay. So exercise is helping that blood flow anyway. So you should keep that up.
Yes. So yeah, I'm not saying that exercise is bad. I'm saying that once you get fit, you should be very careful to avoid any other triggers and avoid overexerting yourself because you're still at risk of having a sickle cell crisis.
Yeah.
So what I would say now is just don't try to show off. Don't try to, push yourself too hard. Just stick to what you can do consistently and increase it very, very slowly and carefully.
Yeah, thank you. That's very helpful to know. Let's talk about future progression in terms of sickle cell. Do you feel like it's possible to eradicate sickle cell?
It depends what you mean by eradication.
Like completely get rid of sickle cell, like forever?
Technically, yes. If everyone were able to, reproduce with the right genotype, then eventually there wouldn't be any people with the sickle cell trait left.
Yeah.
The issue is that I don't see that happening.
Yeah.
I think it might improve somewhat, but I think the best way is to introduce therapies and disease modifying therapies that essentially change the way that sickle cell presents. So they treat the symptoms of sickle cell to a point where you're not experiencing any pain or any organ complications. So I think that's possible, and I think what's happening right now is there's a lot more gene therapies that are in development.
Okay, yeah.
And this is now a sort of new tool to tackle sickle cell from a different aspect. So it goes right back to the hemoglobin and the genes that are creating the hemoglobin and altering them so that they're expressing either more fetal hemoglobin, which keeps someone safe from having crises, or expressing normal not expressing normal hemoglobin A.
Yeah. Would you want to go through like gene therapy if you had the option? Would you go through that?
I thought about it. I think the issue really is just balancing the level of severity of your symptoms of sickle cell and the sort of risks of going through gene therapy and having to go through the chemotherapy. Because shall I just explain what the gene therapy process is? Yeah. So with gene therapy, you have your stem cells, which are the cells which are responsible for forming your red blood cells, your white blood cells, your platelets, and they live in the bone marrow.
Okay.
So what gene therapy does is take those stem cells out and alter the genes inside them so that they turn the gene that makes fetal hemoglobin back on.
Okay.
So these stem cells now produce red blood cells that make loads of fetal hemoglobin. So in order for them to be put back into the bone marrow, your bone marrow, and start expressing red blood cells, you have to have chemotherapy to wipe out the rest of your bone marrow so that the old bone marrow that is making the sickle hemoglobin, not making fetal hemoglobin, doesn't do its thing and start interfering. So that's the most sort of risky part of it. For me, I wouldn't mind having it, but I think it's a lot to go through. Being that for the last 10 years I've not had a crisis. So sure, there's a lot more that I could probably do in life if I wasn't having to worry constantly about making sure I'm not having a sickle cell crisis, because there's a lot of work that goes into that. But yeah, I think that the timing of it is just not working for me right now. Yeah.
So I know in New York they had cured a patient from sickle cell using gene therapy. So would you only recommend that for someone who's having regular crisis and it kind of makes it worth the risk of having the gene therapy?
Yeah, I think I recommend it for anyone who wants to have it. But I think we've got to think about the centers that are providing it, and it as a scarce resource right now. It's only really being offered to people with the most severe forms of sickle cell that are going to have the most benefits from having the procedure. I guess what I advise people is, if you're worried about the side effects and the risks, is to think about the risks of living with sickle cell
in itself.
So a lot of people I've spoken to that have decided to have gene therapy or bone marrow transplant, which is the other curative therapy, they told me that they're basically in a position where they thought that they would die from sickle cell if they didn't do something. And so it became a lot easier to then go for something like gene therapy or go for bone marrow transplant, knowing that there's a risk that it might not work, because the other option is that they just do nothing, and sickle cell, runs its course for them, because in their case it was very severe.
Yeah. Wow, that's deep. I didn't even expect it to even sound that serious as well. And I think so with the gene therapy, what are the side effects that you're worried about that stop you from going forward?
So I think the main thing I worry about personally is the risk of infection when you're on the chemotherapy. So that's a very vulnerable period when you've kind of had all of your immune system wiped out, and you're very at risk of getting severe infections and complications from sickle cell as well, because of the stress of that. So you have to kind of be isolated and stay in a room in the hospital for quite a long time. And I think living like that, it would be worth it. But that's something that I would really think about, whether you want to be sort of isolated from people for that long. Just for me personally, I think if I was younger, it would have been fine.
Yeah.
But now I'm sort of at the age where I guess I have more going on. I'm thinking about like starting a family as well.
Yeah.
So I think it's just the timing of it is not ideal, not convenient.
Obviously, we spoke about eradicating sickle cell, and that's kind of only possible if we all know what our genotypes are. Because my cousin was in a relationship with this lady, and she had a sickle cell trait, so she was AS. And she had asked him, what's your what genotype are you? And he didn't know what his genotype was. Upon later finding out, he found out he was AS. So she, ended the relationship straight away, because she thought there's no point going into this with a risk of falling in love with this person that I can never, have children with, because we're both AS. So I guess if we all know what our sickle cell, traits are, we just have to kind of choose our partners carefully. And in due course, there would be less people, having SS or, AS genes as well. How does that sound to you? Would that kind of be the plan of how we can eradicate sickle cell, would you say?
Yeah, that is one strategy. I think it is important for people to be aware of their genotype and to, keep pushing that awareness, so that when two people, decide to start a relationship, they're completely, aware of the chances of having a baby with sickle cell.
Yeah.
The other thing that factors into this, in the UK, is that we have access to IVF. So this is actually a way that two carriers can safely have a child that doesn't have sickle cell, because they are able to have IVF, look at the embryos, and only implant the ones that they're either carriers or they're AA.
AA.
Yeah.
Oh, that makes sense. Obviously, that's like the most extreme way. I guess if you've already fallen in love, then you go through the IVF option.
Yeah. So you ideally wouldn't start a relationship with someone that was an incompatible genotype.
Yeah.
But there are ways for people who, want to continue a relationship. But it's just that it's not freely available to everyone worldwide. So it's important to be aware of it. If you are in an area like the UK, we're fortunate where we do have free IVF that's offered to people with sickle cell and people with sickle cell trait on the NHS.
That's really good. Have you ever had to like end a relationship because of not being compatible genotypes?
Fortunately, no, I've not.
Yeah. So you kind of always had that in your head that you had to ask someone what their genotype was, or?
I think I've just not really experienced that. So I don't think I've been in a relationship that that got as far as asking about genotypes.
Yeah.
So I've been in like the same long-term relationship since I was like 23.
Oh.
Before that, I'm just a young guy. I'm not thinking about, reproducing. I don't think I've ever, family as like a big value. Having their own family, that's never been like a major value to me. So it's just not something that I've thought about. However, I have always thought, you know, if I get serious with someone, I would want to know that they have a compatible genotype just in case. I have thought, you know, could I be bothered to have IVF? Or would I just rather not have children? Because again, it's not a massive value for me. So I think there's different options depending on what you want from life.
But I think, you know, what's your genotype should be a first date question. Especially when you come to an age of like 25 and you do have a value of wanting to have a family. I do think it should be a first date question. I've never been asked that question in my life. And I think the Black community, we should start asking these questions a lot more, because I think a lot of people just don't know what their sickle cell and what their genotype is.
Definitely I agree. It should be just like a standard thing that you'd want to know.
Do you ever get angry at your parents that, you know, they're the reason you're living with sickle cell? Does it ever make you angry or resent them?
No, it doesn't. I feel like it's a bit of a kind of odd one, because you have to think that like I wouldn't be here if they hadn't made that decision, for one, to even be angry. And there's also no point holding anger over something like that, because it's not something that you can change. And I know it, you know, my parents love me and wouldn't have done anything intentionally, you know, to harm me. So I think that is something that I know not everyone has that. Not everyone has parents that, you know, unfortunately, that is not always like a loving, caring relationship there. And I can understand where that anger comes from. But I think for me, you know, seeing the impact on my parents, seeing me in pain, is all I sort of like need to not hate them. I could never hate them. Like it just seemed completely pointless and futile to like hold that kind of resentment towards them, because they didn't know, they didn't realize, you know, what sickle cell was. And my parents found out when my mum was pregnant that they were both carriers and that there was a chance that I could have sickle cell. So they were offered an antenatal test to see whether I had it or not. But that comes with a risk of harming the baby in the womb. So they said no. And yeah, I had sickle cell, and you know, since then they've done everything to, you know, make sure I was as healthy as possible. So yeah, for me personally, that's an emotion that I could never feel towards them.
That's good. Yeah, that's a very good perspective. Obviously, not everyone would have the same, you know, response as you, but I think that's a good perspective. That no one would do it intentionally. I do think the issue now is that we are becoming aware of sickle cell, so we should do what we can, you know, to avoid high risk relationships and, you know, pregnancies, or plan ahead almost. I just want to say as well, there's a lot of sickle cell births because of lack of awareness, but also because people are testing their genotypes and the tests are wrong. So they're being told that they are AA, and they're actually AS. And that's I know that that's happening a lot in Nigeria, because people that follow me have told me that's happened to them. So people are suggesting now that you should check it twice in 2 different laboratories, check it multiple times. Is it a lab error or just fake news?
It's I don't know the ins and outs of it, but it's just essentially an inaccurate result. So I don't know if it's related to the quality of the lab, but it's something that is so important that it needs to be double and triple checked before you know, going in.
But have you heard that those cases have happened in the UK where we're getting wrong results?
Yeah.
Oh, so basically checked twice. Oh. And I think we need to take it more seriously, because I don't think we do take it serious enough when it comes to checking genotypes, because like my parents always knew about sickle cell. So it's like my mum's AA and my dad's AS. So when my dad found out he was AS, he hid it from my mum, because he was like, oh, I'm already in love with her. What if she breaks up with me because I'm AS. And then my mum asked him, like, you know, what's your genotype? I need to know. And he was, you know, trying to keep it secret. She's like, go to the lab, get it checked. Obviously, he had to end up giving her the result. And she was like, it's fine, I'm AA, like, it's okay. So it was kind of a relief, but I don't think we have that same urgency now that, I don't know, my parents had when they were kind of getting together and stuff.
Yeah, and I think it's also down to the fact that you just want the relationship. People want the relationship to work, and like they are not aware enough of the, you know, consequences of a child having sickle cell that they're able to think about that and put that before their own desire to be in a relationship and make it work. And you know, a lot of people are vulnerable to religious beliefs where they think that they're able to sort of heal a child with sickle cell through, you know, prayer and things like that. And I think, yeah, it's a very common situation where people have a child knowing that there's a risk of sickle cell because they're incompatible genotypes, and they believe that
they can pray it away.
They can pray it away, or they believe that they'll be blessed. And you know,
what do you think about that as someone living with sickle cell? Does that make you angry?
Again, like it's ignorance, really. There's no point being angry at it because it's just a lack of knowledge and a lack of awareness.
Yeah.
It frustrates me more when people who don't have sickle cell or are not affected by sickle cell in any way try to push this agenda to sort of profit off people. So I guess I'm talking now more about there's something called like plant stem cell therapy, which is being pushed by certain companies in certain areas of the world who are using the buzzword stem cell to essentially take advantage of people that are aware of the bone marrow transplant, stem cell transplant cure, but aren't able to afford to pay for that procedure to have the bone marrow transplant. And they are saying, okay, we have this stem cell therapy which uses plant stem cells to cure people of sickle cell, and it's just complete bullshit, basically. You drink a drink, and they say that the stem cells just work in your body and they heal any illness, and they can heal sickle cell and change your genotype. And people are desperate to believe anything, and they get taken advantage of. So that really frustrates me and angers me, because people will end up seeing these things and getting their hopes up, and then having to live with, you know, they might make decisions to have children based on the existence of that. And
that should be illegal. It has to be. It's just fake medicine, basically. Wow.
Well, the thing is, like, it's a lot of it is placebo, because they're basically saying that this is a cure-all for every illness, every chronic illness. And the thing is, it will help improve some illnesses just because of the placebo effect. But for sickle cell, it's not going to do anything to change the DNA, to change the genes that are making the sickle hemoglobin.
Wow, thank you very much for such in-depth conversation. This has been very, very beneficial. My last question for you is, what would you advise your younger self? You know, as a young boy living with sickle cell, and now you're grown up, what would be one thing you would tell your younger self?
I tell my younger self to not worry about trying to be normal.
Yeah.
So the thing is, living with sickle cell, which is an invisible condition, when you're young and you're in school and, you know, you've got peer pressure, you just want to fit in and be like everyone else. So you end up doing things that trigger your sickle cell crises because you're trying to, you know, keep up with everyone else and keep up with the other kids and be normal and fit in. And I think this is something that everyone has to sort of learn themselves where their own limits are, but it can make you feel like really sort of down. And, you know, I think that's where the anger comes from, in terms of like, well, why do I have to, you know, live like this? Why can't I just be like everyone else, kind of thing?
Yeah.
But yeah, as I've grown up, I've just realized that it's okay to, you know, do your own thing in life and not be like everyone else, and you know, just be you, and be like accepting of sickle cell being part of you. And yeah.
Oh, that's really really helpful. Thank you so much. Thank you so much for being on the show. Can you tell us where to find you and what your handles are on your platforms?
Yeah. So you can go to www.sickleverse.com, which is my website, where you'll find everything. I'm on Instagram as Sickle Cell Coach, TikTok, Dr. Lewis Thomas, YouTube, Sickle Cell Help. Yeah, that's it. There's a Sickleverse WhatsApp community that you can join via the website. So if you just go to sickleverse.com, you can find the link there and join us with people all over the world living with sickle cell.
Perfect. Thank you so much. And we always have an episode special where we ask one question to every single person who comes on the show. If you had 3 chances to live, what would be one thing you do every day to stay healthy? So take a card. Take any card. So what was one thing you would do to stay healthy?
One thing I do to stay healthy? Drink water.
Really? Okay,
that's
fair enough.
The only thing coming into my head right now.
Fine. Why have you picked drink water out of everything else? Like, you got to eat healthy, exercise. Why have you picked water?
Because dehydration is such a common trigger for sickle cell crises. Yeah, just drinking water is literally overlooked, I think, in general, in terms of being healthy, you know, exercising, weight training. Yeah.
How much water do you drink in a day? Like, would you say?
I try and have at least 3 liters.
Okay.
Yeah.
Fine.
Yeah. I don't go too crazy, but I do try and aim for 3 liters. Sometimes a little bit less, but I aim for that. Yeah.
Okay. Fine. Thank you very much for your answer. Should we grab a shot?
Yes, please.
Yeah. So this is a turmeric and ginger shot. So let's see how it tastes. You cheers.
Cool.
I hope it tastes good for me.
You're just having the same.
Yeah. Quite spicy.
Yeah, that's got a bit of spice to it.
Thank you so much, Dr. Lewis, for coming onto the show. We're very grateful to have you. Please make sure you guys subscribe to the channel. Please give us a follow. Also leave a comment down below what you have learnt. And thank you very much.